3 millimeters and no positive afferent pupil effect, and eye movement is poor. And her fundus shows on the left eye multiple congenital hypertrophy of the RP. So this is a pretty unusual thing. I heard Jerry's lecture 2 days before, and Jerry, what happened? This patient multiple therapy is coming. I don't think this is a Gardner's disease.
Can I ask a question? You mentioned that these were multiple congenital hypertrophy of the retinal pigment epithelium, but they really look atypical. They look like laser spots.
Yeah, she doesn't have laser history. Okay. Anyway, so she had a proptosis. We did a CAT scan. So left orbital apex, we can see diffuse tumor and some cavity or cyst on here, and MRI scan shows this is T2. Here we can see some capsule or something here, and T1 shows a high intensity, and gathering shows diffuse enhancement. At this time, FDG PET was done, and so this is SCB max is 4.0, and the system is very clean. And at this time, what is this orbital region, and so the relationship with fundus region relation with. So I'm gonna ask you that this tumor and the fundus region is so something relationship. Do you think what is?
I don't know the case, but
yeah. Yeah, you.
So she had a right acoustic tumor, and I'm thinking acoustic neuroma or whatever, and I'm thinking, could this be von Hippel-Lindau disease with multiple lesions in the eye that might have been lasered? But it's hard to put that together with the orbital mass.
Yeah. So she has acoustic tumor history. So first, I'm very suspicious about metastatic region, but she doesn't have blunt, and so we do the surgery and to go removal. The neurosurgeon does it, and in surgical we can't see any solitary mass. All the region is like marble, and pigment region is in the fat soft tissue. We can take all of the tumor, and we can see pigment region in their bone and on the dura matters. The specimen, and after this surgery, her vision is 0.01 to 0.5. The pathology shows this one, melanocytoma or the apex and dura mater and bone. And I think it's very atypical, but and therapy combined hamartoma is the most common one with neuron fibromatosis type 2, but so is this chance for therapy with neurofibromatosis? How do you see Jerry or Kiara? It's totally unrelationship or a relationship something with therapy and orbital melanocytoma and acoustic tumor.
Does this look like a blue nevus to anyone? If they call it a blue nevus?
Blue nevus, but so you can see that it is.
There was no cutaneous blue nevus that was visible?
Like this?
Yeah, that doesn't look like there's any blue nevus on the skin there.
Yeah.
And there doesn't look like there's any melanocytosis either.
You can see blue nevi that involve, they're not ocular melanocytosis, and they're not involving the lid from time to time. We see them in the orbit, and most of those have a little bit of periorbital pigment on the skin, but this is a very unusual lesion that could be just a variant of a blue nevus. Histopathologically, that you showed sort of suggested that as well.
Dr. Fruta, why did the patient have laser to the eye?
Laser?
He thought that was chirping.
Okay.
I could.
She didn't have, the patient did not have previous laser?
No, she doesn't.
Okay.
And so after this, we just follow that, and 2 years later now, her tumor is grows, and then vision is 0. Now we are thinking about totally resect here, so behind the eyeball. Thank you.
Patients with neurofibromatosis are at higher risk for cutaneous melanoma and conjunctival melanoma. That is well established. So maybe that there is a relationship with NF here with that pigment lesion. Dr. Rishi.
So I would like to know what is the refraction for the left eye and the axial length, because the fundus shows a temporal crescent in the left eye, which
Yes.
is much more than what is seen in the right eye. So do you think it is a highly myopic eye?
No, it is about normal, maybe -1 diopter or something.
So next speaker should be Dr. Hanoba, but he's not present this time. So